I can't think of a better person to help us navigate those waters than Dr. Martha Tingen. She's back on the Means Report. Last time talked about smoking, this time breast cancer. She's an associate director over at the Georgia Cancer Center. Dr. Tingen, thanks for your time. I appreciate you.
Absolutely.
Let's just look at breast cancer from the 30,000-foot view if we can. There's so much awareness. There's a month dedicated to it. There are pink ribbons everywhere. There's a Miracle Mile walk. Have you seen fewer patients come through the door? Are we making a dent in it?
We're definitely making a dent in it. Women are beginning to say, hey, this is for real. I need to think about it. They're thinking about, has their mother had it? They're thinking about, has their grandmother had it? Has their sister had it? Has their aunt had it? So yes, we are beginning to make a dent in it because of all the publicity and because people are getting more interested in their own health care.
Okay, so if your mother or grandmother or some relative had it, are you definitely going to get breast cancer?
Absolutely not.
Okay.
So there is genetic testing available for those people that are at risk. That is not everybody. But family history can mean a lot. And what family history really should say to someone that is younger is, if you do have a relative, perhaps you should get a mammogram earlier than would be the normal recommendation. So pay attention to what's happening around you with your family, and it might make a big difference for your health long run.
What else causes it? I don't want to step on our second segment, which is all about the right choices that we can make with our lifestyles to try to ensure that we're cancer-free, but what are some other causes other than, or indicators even besides heredity?
This will probably shock a lot of people, but I'm a bilateral breast cancer survivor myself, and that may or may not shock people. But I'll never forget the day my surgeon told me, and I was in his office after a breast biopsy. The first question he said, Martha, how much are you drinking these days?
Well, first of all, you have to lie when the doctor asks that.
No, I always say be honest.
And I've heard they always double it. But go ahead.
And I looked at him and I said, why are you asking me about drinking? But it's fine with me. I'm very comfortable with it. I don't drink anything. And he said, are you joking me? How many glasses of wine a day do you have when you go home from work? I said, honestly, Dr. Cooper, I don't drink anything. And I said, what does this have to do with our breast cancer discussion? He said, Martha, it is 100% predictive. As a woman ages with each year of life, if they drink on a regular daily basis, even on a weekly basis several times a week, if they live long enough, they will get breast cancer. I was appalled. I had no idea, Mr. Means, that's the way things work.
And here you are not touching it.
Not touching it.
And have bilateral breast cancer.
Right.
How long ago was that?
That was actually, I was diagnosed in 2013, so thank the Lord, I'm still here today.
Amen.
I will say that I was quite my own patient advocate. I think I made several of my physicians very angry because I initially was just diagnosed with a small lump in my right breast, and I literally demanded, that I have further testing to make sure I didn't have it in my left. I have so many friends and so many people I know that are diagnosed with one-sided breast cancer, and in 3 years, 5 years, they all of a sudden have it in the other side. So I'm a nurse and I'm a scientist and I'm a big investigator. So I immediately started doing my own study on myself. And so the last time I said to my doctor, I said, you have two choices today. You can either order me an MRI, or either you can suggest to me who you'd like me to go to. I'm not moving any further in my treatment until I know for sure what we're dealing with. So what ended up happening, I actually had 2 cancers in my right breast and 2 in my left. So 3 that had been undetected.
What about women who don't do their own research, who don't have an advocate? How are they supposed to handle that kind of a diagnosis, just one breast only?
Well, what I am encouraging everybody that is watching your show today is to do their own research, to ask questions, to ask questions, to ask questions. Go online to the American Cancer Society's website, to the National Cancer Institute's website, to our cancer website at the Georgia Cancer Center. Find out all the information you can and ask all the questions you can. So I was told the tumor board didn't think I needed to do that. And I said, there's just a voice in me that feels like I need to know. And I said, I hope I get a clean report. But I didn't get a clean report. So, and then the other thing is, if you find out you do have breast cancer, there are really lots of options.
Sure, there are.
There's lots of options.
What if you have the BRCA gene mutation that indicates that you're probably going to get breast cancer, take action right then or wait?
So if you have the BRCA gene, that is a serious conversation you need to have very soon with your physician as well as a genetic counselor. That is not anything to ignore. Based on your genetic status, based on your family history, they will make some recommendations, and that puts you in a whole different trail than someone who is not BRCA positive.
What about your relationship with your family doctor if someone is diagnosed with breast cancer? Our family doctor typically is a person with whom we're the most comfortable.
Right.
Do you lose touch with him or her once you go down the breast cancer path? Do you have to say goodbye to them and go the full oncology route?
Oh, no, 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 no. So to me, primary care, I call them the gatekeepers of health.
Mm-hmm.
And so I have a wonderful internal medicine physician, and I literally have the greatest and utmost respect for him. And so he was with me in this journey. Did he make the decisions regarding my breast cancer treatments and what I was going to receive and all? Absolutely not. But I kept my regular appointments with him. He was just as engaged as he could be. He was, to me, a real support in my process. So no, I mean, absolutely not. You're dealing then with multiple physicians, but each one has their real unique niche.
They're always, that primary care doctor going to be by your side.
Yes, and not only that, but he sees the whole picture.
I was going to ask you about something that confuses me. For the longest time, it seems that we heard women should start getting mammograms at 40, and then the number changed, and then it was optional at a certain age, semi-mandatory at another age. What do you have to say about when it really is time to start getting mammograms, and then how often should you?
So the U.S. Preventive Task Force has changed its mind several times, and this is what I say to every female. If you have any concerns that you might have breast cancer, to talk with your physician about it. And I think most physicians always want to err on the side of caution and safety. And if they have a female coming to them with concerns about needing to have a mammogram ordered, I think they would order it for them.
What about the insurance company? Might they say, nope, doesn't meet our guidelines, you don't need one yet?
And so for those people, you have to make a decision. If your doctor orders it and it is refused by insurance, there's some things, I always ask the question, how do you put a price tag on life?
Well, how much are those things straight up if it's out of pocket?
Oh gosh, out of pocket if you had a mammogram, I'm taking a wild guess because I haven't looked this up for a while, but my guess is it'd probably be over $100. And remember, every test you have, you get a technical fee for the actual person, the facility that is performing it. You might get a fee for the person that's actually doing the exam, and then you get a third bill for the radiologist who's reading it. So you're looking at 3 fees. So I was referring only to one of those fees, so it could be a lot more. However, typically, if your physician orders it, it is documented and you need it, insurance is going to cover it.
Probably my last question for this segment before we go on into the world of lifestyle choices, and that is breast self-exams, BSE, still the first line of defense? You don't have to wait to go to the doctor for that?
Absolutely not. I strongly encourage breast self-exams. It is a key thing to do. There's very specifics about timing of the month. This is the best time to do that. If you feel a lump, I don't care how small it is, anything unusual about your breast, you should immediately go see your doctor and your OBGYN doctor and have him funnel you in the right way, or your primary care doctor if you do not have OBGYN doctor. 100% yes. Breast self-exams don't go away, axilla, under the arms filling, all that, very, very important.
All right, good advice for sure, Dr. Tenjian. When we come back, we're going to talk about a relatively new role for Dr. Tenjian. It's a role that encourages you to make better lifestyle choices. Did you know that 4 out of 10 women who get cancer may have been able to prevent it due to modifiable risk factors? How about that? If you just change a couple of things in your life, maybe you'll live longer. We'll break all that down on the Means Report. Welcome back to the Means Report, everybody. Dr. Martha Tenjian is our special guest today from the Georgia Cancer Center. We talked about breast cancer in general in our first segment. Now we're going to talk about choices that we all can make to perhaps prevent us from getting it, or at least reduce our risk. Dr. Tenjian, just in our conversation during the commercial, it struck me that people shouldn't drink a lot.
Yeah, that's right. Yes, so that's one of many lifestyle risk factors for cancer. So what we're trying to do at the Georgia Cancer Center is put together a phenomenal research program and community engagement and partnership program to address what I call risk factors that we can enhance protective factors and prevent people from ever getting cancer. That's the goal.
Yeah, but if you prevent people from ever getting cancer, do you still have a job?
Yeah, I do. I do.
Right.
Because unfortunately, probably not in my lifetime will we be able to achieve that. But yeah, there'll still be people that are smoked that are still alive. And so that's one of my big things. I'm always trying to get people to quit smoking. So we're really focusing on basically 5 things. We're focusing on tobacco. So tobacco, as you may know, is related to 16 cancers. 16 different cancers. Causes 90% of all lung cancers, which are the #1 cause of cancer deaths.
Tobacco's horrible. What are the other 4?
So the other 4 are obesity. Most people don't realize it, Brad, but 13 cancers are related to obesity, and obesity is the result of 40% of all cancers in the whole United States.
Let me stop you right there.
40%, that's a lot.
What is the connection between weight gain and the likelihood of breast cancer recurrence?
I am so glad you asked me that. So at my first follow-up appointment after I'd had surgery and I was beginning, my doctor said, I want to share something with you that's kind of not very good news, but he said every woman that's diagnosed with breast cancer, he said the likelihood is they gain on average 15 pounds. I said, you're kidding me. He said, no, that's just the way it is. And he said, I want you to know, Martha, for every pound you gain, he said, you're not overweight now, but for every pound you gain, increases the likelihood that your cancer will return somewhere else in your body.
Just from weight gain?
Just from weight gain. So for me, that was like big bad news. So I went on a very healthy plan. I'm really big on most people do eat garbage each day.
Sure.
And so I went on a healthy plan and I lost 20 pounds, and I'm thankful to say I've kept it off, because if my cancer ever does return, it's not going to be because of obesity.
No, it sure won't be, and way to go on that. I know it's difficult. It's a lifelong journey.
It is.
Tobacco, obesity. What are the other 3 things we hate?
We said alcohol, and what people don't realize is, I mentioned earlier breast, also related to the liver, also related to colorectal cancer, also related to esophagus cancer, our swallowing tube, and also related to stomach cancer.
And so should you just quit drinking, or is there a certain number we can have each day?
I say the best of all is to be a good old-fashioned teetotaler. That's my personal opinion.
Yeah.
I'm not being judgmental of anybody that does drink. I think people should know there's a risk, high risk associated with cancer, especially for women with potential for breast cancer, as I shared earlier, and liver cancer especially.
Dr. Tenjian, everything causes cancer, doesn't it? Everything causes cancer.
I don't really subscribe to that. I think we've identified the main causes through lots and lots of research. Another one that often gets overlooked that people are not aware of is sunlight and ultraviolet exposure. So really sunburns. Did you know that sun exposure is cumulative? So I'm not sure as a baby if you were burned many times or not.
I was, like 2 bad burns.
So this is the deal. Your skin never recovers from that. The redness may go away, but the damage to your skin never recovers.
What's the solution before you get burned? Is sunscreen every day of your life?
The solution is to you always use sunscreen that has a UV factor. What's recommended, a minimum is 15. The best is 30 or above.
All right, let me try to break each one of these categories down. You talk about sunscreen. Women, a lot of their makeup has it in it. A lot of their foundation does.
That's exactly right.
What about guys? Are we supposed to rub lotion on our hands and face every single morning?
If you are going to be in the sun a lot, absolutely. Put on some good sunscreen.
That's a total pain.
I know it's a total pain. You'd be shocked how many people get burned on their necks. You know, you see people with farmer's tans, you know, would take their shirt off and their chest is white. But yes, sunscreen is a really big deal. 9 to 10 skin cancers are directly related to UV exposure. And there's one other one that we cannot miss for prevention and lifestyle, and that's the human papillomavirus, often referred to as HPV. Linked most of all related to cervical cancer, big predictor of potential cervical cancer.
Should teenagers get the shot?
Teenagers should get the shot. The shot has shown incredible results in being preventive.
I once heard a mother say, I'll never let my daughter get that because she's not promiscuous.
Well, you know, I think that's wonderful if she's not promiscuous. I think that's great. However, there are some people that may get the virus, and it usually is spread that way, but if you knew that you could take a pill and it might prevent you from getting the cancer one day, even though you didn't think you were at risk, would you take the pill or not?
I'd take it 100%.
Okay, so that's kind of my answer for the people that are like not HPV positive about taking things.
So when someone comes to you at the Georgia Cancer Center and they say, look, help me with my lifestyle, help me be at a lower risk, what do? Do you sort of become like a personal trainer?
So I like to say a coach. I would really love for our team, we have a wonderful team of about 20 people that work in cancer prevention and control. We're very focused on addressing health disparities, which is another whole topic, but I'd love to talk about with you one day. And we want to just absolutely help everybody make the best choice for their health every day. So I'll just give you a quick thing. Have you heard of Red Ribbon Week?
Red Ribbon Week, I thought that was a heart disease thing.
No, Red Ribbon Week is a national week across the entire nation based on a young, great guy that was passionate about students not becoming involved in drugs. So because tobacco is a drug, very addictive, kids are vaping like ever.
I was going to ask you about that.
The CDC just released yesterday, it was a new name, a medical diagnosis called EVALI, E-V-A-L-I, standing for e-cigarette, vaping associated lung injury. We now have 26 deaths across 49 states, over 1,226 hospital admissions. So help me understand, Brad, how we get bad romaine lettuce from a country. It gets pulled off every shelf, out of every Panera Bread, out of every associated thing, and nobody eats it. But we've had 26 deaths from vaping, and everybody is still puffing away.
My high school friends would tell you that it's because the stuff that's killing people is the black market additives, not the over-the-counter stuff.
They're smoking the good stuff, right?
Correct.
Yeah, well, that's not necessarily true. All those people that are dead, I'm sure they thought they were smoking the good stuff too.
You never know what's in it.
You never know what's in it.
It's liquid. It's just, I don't get why it's so popular, but it is.
And at a recent event I was at, people are now putting THC oil in it. You know what that is.
I do.
A very, big form of marijuana that makes you feel the greatest high. And if you are found with that, it's a felon. That's kind of a big deal. Whereas if it's traditional marijuana, it's considered a misdemeanor.
I know. What happened to simple Marlboro Lights when we were kids?
I know. The great news is smoking has gone down like crazy. But the very bad news is all of our efforts toward youth smoking have been erased. That's not my word, that's the Centers for Disease Control word, with the onset of vaping.
Dr. Tingen, it seems that if you're managing someone's lifestyle or serving as their coach, that it's a lifelong commitment if you're trying to keep them cancer-free. Do we stick with you forever?
I'd love for you to stick with me forever. I think the biggest message of all we can do is, as parents, would you please role model healthy behaviors for your children? Children love their parents. They love them regardless almost of how they're treated. And I have lots of games I play. When I go to the grocery store, I look at the person pushing the cart and I see what's in their buggy. It's usually pretty protective. The other thing that I think is really sad is there is data that shows, Brad, if families will eat one meal a day together with every electronic device down, nobody's on their game, nobody's on their iPad, nobody's on their iPhone, nobody's talking through a thing in their ear and engaging, they have a conversation like you and I are, it can prevent up to 60 to 70% of any type of drug abuse. And when I say drug abuse, I'm including tobacco here.
Just having conversations.
One meal a day. So we actually have a big program in the community called the Strengthening Families, and it starts with those families eating a meal together.
Let me ask you this, and I'm not trying to be flippant. I'm trying to help people who are watching who might say, look, I can't change. I'm an overeater, a drinker, a smoker, a person who loves to get tan. Can't you do all those things perhaps away from your children? Put your beer in a cup, smoke on the porch, eat a pizza after they've gone to bed, and still be a good parent? Do we have to undergo a complete transformation to be a role model?
You know what I say? I want you to live a long time to be a good role model and to be a great parent. That's what I say. And kids are very smart. The vast majority of children that take up the habit of tobacco get it from a loved one. So they're perceptive. They're very perceptive. So I'm really, and we can help you. If you are having struggles with alcohol, there are numerous places that can be very successful. If you're having trouble with vaping, cigarettes, Georgia's Cancer Center has a phenomenal smoking cessation clinic. We will help you with getting you physically unaddicted, and we will help you with getting you psychologically unaddicted.
Can we bring all the teenagers to you and you'll fix them?
Well, I would love to have a home that big because that's how much I love children.
No, at the Cancer Center. Whatever it takes.
But anyway, these are really, so this is what's happening in children today as early as 10 and 11 years old. We are seeing children being put on medications that people normally would not have been prescribed until they were in their 40s or 50s, because they are developing what's called early antecedents of an adult onset disease early in life.
We want you, ladies and gentlemen, to get in touch with Dr. Tingen and her team. They can make a huge difference when it comes to helping you live longer so you can be a role model, and certainly helping to reduce those risk factors. Thank you for everything you've done.
Do you want me to at least give the cessation phone number?
We can give it, or we can put it on the screen. Say it real quick.
Okay, it is 706-721-0456.
721-0456. Call it right now, or call it if this is airing on a Sunday, the next business day. Bless you, and thank you for what you do.
Thank you for having me.
Absolutely. Martha Tingen, Georgia Cancer Center.